Hi, my name's Dr. Jackie Wilmshurst, and I'm about to show you why you need to approach your employee mental health strategy differently. My 4Ps framework is trusted by some of the best known brands in the world. So what is it and how can it help you? If we're to create an employee wellbeing experience that truly addresses all that a workplace should, it must contain these 4 core elements. Firstly, promotion of positive health and wellbeing. Secondly, prevention of harm by avoidable risks. Thirdly, protection from harm by unavoidable risks. And finally, provision of support and resources for recovery from injury or ill health. So let's map some of the most common mental health offerings onto this framework. If you do already have an employee mental health strategy, you likely have good benefits package, learning opportunities and other resources to promote positive mental health across your workforce. As part of this, you may well also have resilience training. It's now likely you have an employee assistance programme or EAP that includes a confidential counselling service. You may even have trained and implemented a network of mental health first aiders. These are all important and valid components, but they're far from the whole picture. Let's pause here and move to physical health for a moment. Picture a construction worker whose job is to work at height. We would likely think it ridiculous if we were told that construction workers' health and well-being was taken care of by a benefits package, physical resilience training, education around sleep, nutrition and good exercise, and that if they did fall off the roof, there'd be qualified first aiders on hand and that a doctor would be called if required. We know there's also a health and safety strategy, and that through this, they're equipped via a systematic risk management process with measures to prevent them being exposed to risks that are avoidable and to offer them the training and the personal protective equipment for those that are part of the work. These are designed and tailored specifically to the risks posed by that work. So now let's move back to our mental health strategy. Most of these are still based heavily on benefits packages, events calendars, and reactive support. They also still focus largely on helping people manage personal mental health problems. Rarely are these 2 middle Ps covered in any truly systematic and meaningful way, as we do for physical health and safety. They can't be populated with off-the-shelf, one-size-fits-all programs and interventions, however cutting-edge and evidence-based those might be. They can only be effectively covered through systematic identification of the foreseeable risks in the work or in the workplace to the mental health of your employees. Those risks must then be managed by measures that are matched to the risks. Prevention may require changes at the organisational or work design level, and protection may be more at the level of equipping and empowering your employees to manage those risks that are part of their job. While not yet widely known, this is as much of a legal obligation for psychological risks as it is for physical. So now that you know this, what will you do? Do you find yourself unsure where to start, or is it more about next steps in your organisation? Either way, I can help. Get in touch for a free initial consultation and tell us more about your organisation and your needs.